He who has health has hope, and he who has hope has everything, says Thomas Khalil.
Ba daukan magani duk lokacin da magani ba tare da an shi har ma haihuwa na yi karkashin wannan tsari alhamdulillah gode ma Allah Allah ya kara dokaka ku.
This facility utilization has increased to 32.2% in Kebbi. People are trooping to the facilities because they have now found out that really this scheme means to provide quality healthcare services without financial hardship.
Increase in partnership in 2024 makes it clear that incrementally Kechema is moving in a direction of achieving universal health coverage in Kebbi State.
Kechema, under the leadership of Dr. Jafar, have created a lot of innovation in ensuring that access to health has reached every community in Kebbi State.
Perhaps the unrelenting commitment of the agency for ensuring easy access to quality and affordable healthcare services to the people living both within and without urban centers will entice one to believe that in no distant time, healthcare challenges will be a thing of the past in Kebbi State. This is evident in the fast-moving figure of enrollees from less than 100,000 in 2023 to over 125,000 in 2024. The development opened up a new page to consolidate on its already existing achievements.
I want to tell you that Kechema has alleviated a lot of suffering from my people.
Government, politicians, benefactors, and non-governmental organizations seek Kechema's collaboration for an improved access to quality healthcare service delivery, especially the identified zero-dose areas.
On the 1,000 enrollee, which is to be sponsored by Her Excellency, the wife of the governor, it's a kind of investment. When you invest, that is registering your people, you are gaining a lot on humanitarian grounds.
As practice years before now, in 2024, Kechema collaborates government, associations, and organizations to reach hard-to-reach areas for its conventional medical support to some communities as part of its corporate social responsibility.
Kechema has been doing wonderfully well. So there is nothing more than collaboration with people, collaboration with stakeholders.
The aim of Kechema's partnership is ensuring inclusive healthcare services to all categories of people, especially the poor. Kechema, collaboration for universal health coverage in Kebbi State.
Scientifically, we expect the facility utilization to be 20 to 30%. Now we have 32.2%. People are trooping to the facilities because they have now found out that really this scheme provide quality healthcare services without financial hardship.
The proliferation of the agency's approved facilities across the nooks and crannies of the state might not be unconnected to the increased hospital attendance and facility delivery rates this year.
The Kechema program has been a wonderful program for most of my patients, especially the poor, the masses. They are the one enjoying the program. And I must say it's a very good one that has given good intervention, especially during this time around when people they don't have enough.
I came to the facility when I have a serious stomach pain. After an examination, the doctor told me that I am suffering from appendix. I will have to undergo minor operation. He asked me to wait for some time while waiting for Kechema's approval. After about 5 minutes, I received a call from Kechema. Hajia Umu called to confirm. Honestly, without Kechema, poor people like me cannot afford paying for their medical bill. One might not disconnect the increase to an increase in number of collaborations with the government, especially Basic Healthcare Provision Fund, UNICEF Gavi intervention, political leaders and benefactors intervention as well.
2024, we had altogether 126,000 enrollees. Over 65,000 are from the Basic Healthcare Provision Fund, 37,000 from the formal sector. We have 24,357 informal sector.
UNICEF enrolled 81 children and pregnant women from this community. Out of the number, 56 people visited the facility, and we also have 4 deliveries. We thanked those who initiated the program. One significant factor that contributes to the increase would be the availability of drugs, testing kits, and altogether the actions and inactions of the facility workers.
Three of my children are enrolled into UNICEF Gavi-sponsored program. I brought my first child to the facility for treatment 2 times, and now I brought the second one for treatment too. Honestly, we are benefiting as our children are receiving treatment for free. We thank God. My problem was typhoid and one of my leg as well. Anytime I came to the facility, they test me before giving me drugs, and all is for free.
Prompt release of capitation and pay for service may be an important contributor to the increase in the number of those who visit the facilities, as the capitation is used for the purchase of drugs and other kits for prompt treatment of beneficiaries. This facility carried out many tests like MP,
Muna HB, hemoglobin estimation, Muna RVS, Muna FVS, fasting blood sugar, RVS, random blood sugar, Muna yin kuma TB tuberculosis, Muna AFP, acid pass baseline, sannan muna widal test, Muna PT, pregnancy test, Muna yin na urine kuma muna yin na blood.
At Makuche PHC, we certainly do all the required tests at the primary health care level.
We appreciate our sponsors. Honestly, I cannot imagine receiving treatment for free. May Allah reward them, and I pray for my safe delivery. I was suffering from anemia. The doctor gave me drugs, hoping that it could subdue it, but it persisted. Eventually, he recommended for operation, and it was done successfully. Honestly, I am happy that it was done free of charge. Thanks to Kechema.
Sometimes when you see a patient that cannot afford 3 square meal coming to access medication of more than 20,000 and you tell him that Kechema has covered it, he goes home happily. Or he needs a surgery that will cost him 50,000 and you tell him, since another Kechema, you're covered. The patient actually goes home happily. And we can see the joy in our people.
They gave me drugs, injection, and drip as well, all for free. In fact, I gave birth to a baby in the facility under Kechema.
Kechema ta biya, mun gode sosai da wannan taimako.
Started about 2050. Today, as we are speaking, we are seeing almost about 150 to 200 referrals every month. Healthcare delivery system is to ensure universal health coverage. Universal health coverage is about having healthcare system that is of quality, and it should equally be affordable to the people. It should be available, it should be accessible, and I think this is what Kechema represents.
I could remember there was a time a colleague very close to my domain here suffered a lot in terms of many attacks, that is diseases. He's supposed to have spent a lot of money. With the help of Kechema, he was referred to FMC. Surgery was made. I want to tell you that Kechema has alleviated a lot of suffering. If we are going to talk about the impact made by Kechema in alleviating the suffering, particularly on the health affairs, we have a lot to say.
Joy is a trademark that most people in Kebbi State identified Kechema with. The support enjoyed is not limited to outreaches, free medical services, but also medical support to vulnerables. Thanks to Kechema.